Both the prior speakers have really given me a great lead-in, so thank you for that, whether you do it or not. I'm going to be talking about the Beacon Community Project, which is focused on diabetes, but is also taking some of the concepts that Dr. Jac described in the medical home and working to apply those across the healthcare system at large. Because the reality that we all face is that patients don't stay put. They see different providers, they change doctors, they move across the town or across the state, they change jobs, they change insurers, and so we end up with gaps in healthcare, with gaps in the record and gaps and inconsistencies in the way patients receive care. The Beacon Community Project, as was mentioned, is one of 17 funded projects by the Department of Health and Human Services across the country, really to try and change that and use technology and also common practices as a way to make sure that people get consistent care and that the quality of care improves overall. We are focusing on diabetes, although we look to be doing this for all chronic diseases long term. And we're putting in place a consistent approach. First, implementing technology, and as I know you all are aware, this already is a community and a region that is well advanced in the rest of the country in its use of health information technology. But what we're doing is really filling in the gaps there, linking up all the participating organizations so that they can share information about the patients, filling in the gaps in the records in the individual physician offices so that patients are not getting so that the physicians know and the care team members know what tests are missing, what care has already been received, what hasn't been received, and so forth. Also helping to make sure that they get consistent follow-up, which is very, very important for chronic conditions. Also, we'll be having care coordinators working with the practices and with the patients to follow up and make sure that they're doing what they need to do. Many of you as employers are probably aware of what's called the COHE program, the Center for Occupational Health and Education, which is a program to reduce the impact of workplace injuries funded by labor and industries. And that program has been very, very successful at reducing long-term disability and also time loss. We're modeling this program, the Beacon program, on the COHE model. And so it'll be very familiar to you, the care coordinators, the consistent follow-up, the common practices. We also are going to be giving the providers quality data. That's an intervention that's been proven over and over again, feeding back to physicians information on how their patients are doing overall, not just on an individual basis, but their entire patient population, both in terms of preventive tests and actual health outcomes. And we are going to be doing that based on the entire physician population. Certainly there's practices now that are getting quality measures, but they're getting it based on an insurer, so they're getting it based on an employer. They're not getting it consistently across all the patients they serve. And that's really what they need to know that they're making a difference in the way they change their practice. And then the last piece is training, so that we can't just put tools out there and put expectations out and just say, go do it. We have to support real quality improvement at the practice and the provider level. Because what we're trying to do is reduce the cost associated with diabetes and improve health outcomes. We're specifically measuring emergency department use and also inpatient stays for diabetes-related complications. We're doing it in a very large way. We're trying to implement this across most of eastern Washington and northern Idaho because, again, this is our geography. This is a population of patients that we all see. These are our families, our friends. You as employers can really help in this by encouraging your employees to participate, to go to a provider who's participating in the Beacon program. You can also encourage the healthcare organizations. That was a great lead-in on panel 1 about what can healthcare organizations do. You can encourage organizations to participate as well in the Beacon project because we really will be setting a model for consistent care and consistent delivery across the region and measuring very quantitatively the changes we'll see in patient health and costs of healthcare. Thank you.